Have you ever wondered if it's okay to eat tangerines every day? You might be surprised to know that while these little citrus fruits are packed with nutrients, they could be problematic for your kidneys. Hi, I'm a urologist and pelvic surgeon, and if you're new here, I make content about your health every Monday and Friday. So make sure you share this channel with your friends so we can get evidence-based health information all around the world. Today, we're going to talk about what happens to your kidneys. If you eat tangerines every day, let's start off with what's great about tangerines. They are delicious, super easy to peel, and are a good source of fiber, vitamins, and minerals. But most importantly, they're packed with lots of These are compounds that help reduce inflammation and oxidative stress or free radicals in our body. Free radicals are created when we eat or burn calories, meaning that almost everything we do generates some amount of free radical exposure. And too much free radical exposure has been associated with many diseases like heart disease, cancer, Alzheimer's, as well as chronic kidney disease. And tangerines are packed with antioxidants like vitamin C, which can help our bodies fight free radicals and reduce inflammation. This is great because inflammation is a risk factor for kidney disease. In fact, there are studies that have shown that people who ate more fruits, like tangerines, had lower levels of chronic kidney disease. And lastly, tangerines are about 92% water, which makes you stay hydrated. And as I've said before, your kidneys need plenty of water to function optimally. So now that we've talked about all the great things that tangerines can do for your body, let's talk about how it affects your kidneys. The first thing to note is that it really depends on your kidney function. And if you have any underlying kidney disease, if you have normal kidney function and no kidney disease, you're probably not at risk of kidney damage from eating tangerines. But let's talk about some of the components of tangerines that might be harmful to your kidneys. First is potassium. As I mentioned before, tangerines are a great source of potassium. In fact, one medium-sized tangerine contains about 228 milligrams of potassium. For most people without kidney problems, this is not an issue. In fact, it's recommended that adults consume between 4,700 and 6,000 milligrams of potassium per day. However, for people who have chronic kidney disease or decreased kidney function, your kidneys are less able to remove extra potassium from your blood. And so having too much potassium in your blood, called hyperkalemia, can cause irregular heartbeats, muscle weakness, and even affect your kidneys further and decrease their function. Now, how much potassium is too much? Well, that really depends on how well your kidneys are working. In fact, we measure something called the serum creatinine level. And based on your serum creatinine level, your doctor can calculate something called your creatinine clearance, which is a calculation that tells you how well your kidneys are filtering your blood. And depending on whether you have normal kidney function, mild impairment, moderate impairment, or severe impairment, this will dictate how much potassium is really safe for you to consume. But generally speaking, doctors recommend that people with CKD only consume between 2,000 and 3,000 milligrams of potassium per day. As you can see, if you were to eat 2 tangerines a day, that would already put you at 456 milligrams of potassium. And if you add one more, you're at 684 milligrams. So for people who have chronic kidney disease, it's important to limit not only tangerines, but other high potassium foods like bananas, potatoes, and tomatoes to avoid having too much potassium in your blood. Now, if you're not sure if you have chronic kidney disease, you can see your primary care doctor or urologist to get your kidney function checked. The second component of tangerines that may be harmful to your kidneys is citric acid. One medium-sized tangerine contains approximately 19 milligrams of citric acid. Citric acid is usually found in lots of different foods, including apples, oranges, and even berries. It actually gives these foods their tart flavor. But what's interesting is that in our bodies, our kidneys filter the citric acid and excrete it in our urine. Studies have shown that people who consumed a high amount of citric acid in their diet had higher levels of citric acid in their urine. And some people are more susceptible to having increased amounts of citric acid in their urine. These people have a condition called cystinuria. Your body either makes too much or is not able to absorb enough of a certain amino acid called too much cysteine then forms a stone. And believe it or not, 15% of kidney stones are actually made up of cysteine. And since citric acid binds to cysteine, consuming high levels of citric acid has been shown to decrease the risk of cysteine stones from forming. But if you have trouble with kidney stones, you may want to avoid high doses of citric acid. In fact, in some studies, people who consumed the highest levels of citric acid were more likely to pass more stones than those who consumed less. So if you're prone to kidney stones, you may want to limit your tangerine intake or discuss it with your doctor. Finally, for people who are prone to getting kidney stones, especially calcium stones, the citric acid may actually be protective against kidney stones. In fact, in one study, they looked at people who consumed the highest levels of dietary and they found that they were 51% less likely to get kidney stones, which is great news. So for people who are prone to kidney stones, Eating a couple tangerines a day may be helpful. Lastly, there are some people who may be more susceptible to having issues with their kidneys if they eat too many tangerines. And that's because tangerines are acidic. If you don't know, we have a pH scale, which measures how acidic or basic a substance is. The lower the pH, the more acidic it is. On the flip side, the higher the pH, the more basic it is. 7 is neutral, and anything below 7 is acidic, and above is basic. Urine is normally slightly acidic, anywhere from 5.5 to 6. Our kidneys do a great job of keeping our blood at a very tightly regulated level, about 7.4. But if we ingest a highly acidic or highly basic food, it can change the pH of our urine. And if you have very acidic urine, it can lead to irritation in your bladder, leading to symptoms like burning pain when you urinate, pain when you have an empty bladder, and even blood in the urine. Some people are more susceptible to having this happen, including people who've had radiation to the area, women who use diaphragms or sponges for contraception, and people who have certain urinary tract infections. So if you're someone who's prone to having a lot of urinary symptoms, you may want to limit your tangerine intake. So, bottom line, what do I as a doctor recommend? Well, for most people, eating 1 to 2 tangerines a day is perfectly safe, and you do when you have to worry about it affecting your kidneys. But for people who have kidney issues, definitely talk to your doctor first. Eating too many tangerines may not be a good idea if you have chronic kidney disease. Because of the high potassium, if you're prone to getting kidney stones, again, talk to your doctor first. And if you have any sort of urinary symptoms, you may want to limit your tangerine intake. Okay, so hopefully you guys found this useful. If you did, please make sure to comment below. Do you eat tangerines often? And if you haven't seen my video on what happens when you eat too many oranges, make sure you check that out. As always, remember to take care of yourself because you're worth it.